So I think, first of all, I can imagine what we're going to start with. This is one that is very appropriate for the vast majority of our pregnant women, and that is iron, correct?
Absolutely. Yeah. Yeah. And it's, most people, when they're pregnant, they hear about iron, they know that iron's important, but I still find there's so many myths around iron and so many misunderstandings that whenever, you ask me like, oh, what kind of vitamins and minerals should we be talking about for these women? And I was like, oh yeah, we got to talk iron.
For sure. And
Hmm.
so I know the vast majority of our women, so most women who are menstruating, AKA having their period, are losing blood every month. And our bodies are pretty good at recycling iron. So we break down blood cells all the time and we reabsorb that iron and use it to make new ones. But our body isn't great at reabsorbing or absorbing iron sometimes from our food sources. And so most women who are menstruating often need to supplement their iron, either with diet or with medicate or supplements. And that is even more so in pregnancy because our little babies, cute little parasites that they are, they suck our iron stores out of us, right? And so hopefully you can tell us a little bit about iron and how we can actually supplement our diet with that, both with food, but also with supplements if we need to.
Absolutely. Yeah. I mean, iron needs when pregnant go up, and it's for a few different reasons. As the pregnant person, you're needing more iron because you're creating more blood, so you need more oxygen circulating through all these new body parts and that you're growing. And so there's more iron needed for the pregnant person themselves. And then iron is needed, as you were saying, for the baby in the womb. But also what's going on there is that iron is really important for babies for the first actually couple of years of life, like once they're born. There's been from kind of birth until the first couple of years. And yet breast milk is naturally low in iron. So it seems like this kind of weird, like, okay, if iron's so essential, particularly for their brain growth, like their cognitive growth, and breast milk is low, why would Mother Nature set things up like that? But Mother Nature always has, wisdom. And so actually when baby's in the womb, they're stockpiling iron from you into their little bodies that they're going to use for those first like 6 months of life. And so that's why iron is so important when pregnant, because not only are you needing it as a pregnant person, babies needing it for their growth while they're in your womb, but also babies stockpiling iron for their first 6 months once they're born. So that's why iron is so important when pregnant.
Yeah. And then during delivery, even with a normal vaginal delivery, we all lose some blood. That's just the
Yeah.
nature of the beast. And so then we need to like re-get our iron stores up as well in those first kind of 3 to 6 months postpartum, right?
Yeah,
Yeah.
absolutely.
So I think one of the things that I was hoping that you could tell us a little bit about is how do we get that iron in our diet? So what are some good food sources that we can access? And if you don't mind touching, so some people don't eat meat sources, so some kind of plant-based sources as well, that would be fabulous.
Absolutely. Yeah. I'm so glad you asked that because there are so many misconceptions around where we get iron from in foods. And so most people do know, and it's correct, that if you eat animal-based foods, then a lot of them have iron in them. So things like meat, poultry, fish, seafood, definitely great sources of iron. Eggs as well, half decent source of iron. But yeah, it's the plant foods where there are lots of sources of iron amongst plant foods, but this is where I find there's a lot of misunderstanding. Whenever I ask people, like, what are great sources of iron, like say I'm doing a workshop or speaking to a group, pretty much everybody, like right away, the first foods that are mentioned are like spinach or leafy greens. And yet that isn't our best source of iron. Uh, these foods are still super healthy. There's lots of good reasons to have them. Don't let me make it sound like there's no benefit to eating our leafy greens. I'm a big fan of leafy greens, but they are not our best source of iron. I mean, unfortunately, Popeye was not correct in his nutrition information because it depends on how you're looking at it. I look at nutrition from the point of view of human absorption because that's what I'm looking at. So it depends on how you're looking at it. If you're looking at it from the point of view of a botanist, it's true. There is lots of iron in that spinach leaf. And so if you've been looking on the internet and you're seeing, lists of, this many milligrams of iron in spinach, it's not that that's incorrect. That's absolutely true. There's that much iron sitting there in the leaf. However, that iron is attached to another molecule so that when we digest it, we really don't absorb a lot of the iron as human beings. So while there's a lot present in that leaf, not a ton gets absorbed. Now, when we cook spinach, it does free up some of that iron, and so we get some. So cooked spinach is a medium source of iron, but it's not like that rock star source that like kind of like, oh, where do you get iron from? Spinach. Not the knee jerk. And then the rest of the leafy greens are even lower than spinach, and definitely, you still need to cook them. So I don't want to say there's zero iron in there. Of course, there's some, but it's not our best plant-based source of iron. The other sources of iron, great sources of iron that are plant-based, are things like lentils and beans. I've got some examples here, some lentils, some split peas going on. These are from just in my kitchen here. I didn't do an extra grocery shop. We've got COVID going on. I'm not doing extra shops to show, but I just thought, hey, I'll pull some things out from my pantry that are good sources. Seeds are also a good source of iron that are plant-based. So things like chia seeds, or I've got some flax seeds here that you would grind up. Also, of course, tahini is sesame seeds made into a paste. Nuts and nut butters also have some there, so that's a great source. Tofu is a great source of iron as well. So the soy foods, so tempeh, tofu, things like that. And so those are some good sources of iron that are more plant-based.
So I often tell my parents of kids who have not optimal diets, as most toddlers don't, let's be honest, mine included, to make smoothies and throw some tofu in there to help supplement their, because it's pretty benign. It doesn't taste like a heck of a lot. Yeah. So it'll kind of take on the flavor. So as a pregnant woman, we could really do the same. If we were going to make a smoothie, just throw some extra tofu in there, especially if we're more of a plant-based diet.
I love a soft tofu smoothie. And so yeah, often people are adding the spinach leaves, the raw spinach, thinking that that's a good source of iron. Not going to be doing much iron. Great fiber, great folate, lots of other things in there, but it's not contributing the iron. So yeah, the soft tofu is a great iron tip. And then another place that plant-based source where we can get some iron is fortified cereals. So grains naturally are low, but when they make, say, Cheerios or different cereals, they add iron to those grains. So that can be a source as well. And then whenever you're having the plant-based sources, our body doesn't absorb that iron quite as well as the animal-based ones. And so a way that you can boost the amount of iron that you're absorbing from the plant-based sources is to have a source of vitamin C at the same time. So many fruits, bell peppers, tomatoes are all great sources of vitamin C. So, if you're going to have that pot of chili, your beans, have it in a tomato sauce, maybe, have some bell peppers on the side along with that. Or if you're going to have your Cheerios in the morning, have some strawberries too. Those are great ways to be boosting the absorption of that plant-based iron.
Those are actually great suggestions, because I always go to vitamin C and I'm like, orange juice, right? But a lot of women actually have gestational diabetes. And so we want to kind of avoid those just useless calories in juice. But the bell peppers, the strawberries, all of those sources are great sources, and they've got the fiber in them to help slow the digestion and stop that kind of big spike in blood sugar. So those are some great suggestions. Thank you. Now, are you okay chatting about supplements if we need them?
Absolutely, yeah.
Sometimes, despite our very best efforts at getting it all through our diet, we do need a little bit of extra help.
Absolutely, yeah. Supplements totally have a role for sure.
And so usually what we recommend, and if you have any other thoughts, is in pregnancy, iron can be a bit constipating. So there's a couple of irons that are a little bit easier on our stomachs. And unfortunately, most of the constipating irons are because their iron sources are a little bit better than the ones that are more tolerated. So it's a bit of a balance, just finding the right one for you. So the ones we usually recommend are Palafer or Ferromax. Those are kind of the two that are relatively well tolerated, have good amounts. And then we usually recommend every second day. There's some evidence that every second day as opposed to daily actually helps your absorption a little bit better, and decreases the constipation a little bit. And I usually say take them at night just before you go to bed, so that it doesn't bug your stomach too much. And then we also want it 2 hours away from calcium, because the calcium can inhibit that absorption of the iron too. Is that correct, or am I making stuff up when I tell people
all
that?
of those are absolutely correct, you know, and I'm really practical. So if, you know, iron on the empty stomach really doesn't work for you because it just makes you so nauseous you can't take it, I'm like, okay, then let's take it with food, right? Because, and you know, if that food has a little bit of calcium, oh well, whatever. It's still better to take it and with food so that you're actually getting some in, even if you're not maximizing the absorption, rather than being so nauseous and so constipated that you can't even take it, right?
And it's interesting, the prenatal vitamins, oftentimes they're not so tolerated because they have that little bit of iron in them, and they're like horse pills. So certainly women at the beginning of pregnancy really struggle with that, but just take a folic acid and a chewable kids vitamin, I usually say, and get your iron later when you're not as nauseous. Awesome. Okay, so that's some great info about iron. Lots of great tips there. Thank you for that.